Part 3. Where is Mordechai? From physician, spouse and mom to a target. By Raquel K. Oh no, March 26, 2022. This is a work of fiction. Names, characters, places and incidents either are products of the author's imagination or are used fictitiously. Any resemblance to actual events or locales or persons, living or dead, is entirely coincidental. After I closed that Zoom meeting with Dr. Harman about career planning, I started getting really scared. I went back home to my university-owned apartment and couldn't sleep all night. Lying on my bed, staring at the ceiling, I began to look back at the past. I started reliving incident after incident. Where I had once been confused, I began to see light. A clear pattern had emerged. It was evident now that Dr. Harman and his crew were speaking in what had to be code. Naively, I had dismissed each thinking that this was CAMU and the United States and that it had to be crazy thinking. Was I crazy? Did Dr. Mann really expect me to pay him under the table for moving me to the non-fee clinic? Did Dr. Harman really provide me a price to become a medical director? While he never asked for anything, he did physically point at a dollar figure telling me not to forget it. So I asked myself and ask you here, do you think $290,000 was the going price for advancement? Was this really a pay-for-play scheme orchestrated by the Senior Vice-Chancellor of Medical Services? How could this happen at CAMU Health? Then there was the issue of my unexpected transfer out of the Vashti clinic and yet leaving me with a skeleton presence in that clinic. Was this simply a pay-for-play, or was there more to it? Were there other players involved? What about the role of Dr. Julie Pritzker, the medical director of the Vashti clinic? Why would she be so supportive of the move? After all, my workload made up more than 50% of her 2 combined suites at the Vashti clinic. In fact, even with my productivity in place, the CAMU Vashti Women's Health struggled financially, especially at the peak of the first outbreak of COVID in Los Angeles, when in-person clinic visits dropped dramatically. I kept thinking how Dr. Pritzker could benefit from my move out of her clinic. It was then that I felt cold shivers run down my back. My body began to shake, and I got really frightened. I asked myself, over and over, did this go beyond Dr. Harman's personal enrichment? Was I in the middle of some kind of organized crime scheme? Once again, the question that I could never get out of my mind even until this day, who is Dr. Harry Mann and who and what did he represent? All I can say is that Dr. Harry Mann is no ordinary physician, no ordinary administrator, and is nothing that he presents himself to be publicly. The little I know of Dr. Mann comes to me by private conversations I have had with him, bits of small talk, a lot of code inferences and my own independent research. Harry, as he is known to his family, is a second-generation American. Growing up on the East Coast in the suburbs of Pennsylvania, near Hershey, Harry was the middle of 3 children of Kenneth and Grace Mann. Unlike his younger brother Brian, who went to trade school and became a plumber, Harry and his older brother, Andrew, shined academically and would become the stars of the family, with Harry always somewhat jealous of his older brother, always somewhat in his shadow. Harry scored 139 on an IQ test, making him just short of a genius, while Andrew scored well over 140. Securing the top spot. Both attended very prestigious undergraduate schools. Andrew went on to attend the Royal Cambridge University in London, receiving his PhD in physics and quantum mechanics. He would eventually marry the daughter of the famous American author, F. Scott Fitzgerald, Leah Fitzgerald. They would only have one daughter, Jacqueline Fitzgerald Mann, who would later join the U.S. Department of State as a Foreign Service officer at the U.S. Embassy in Denking. Both Andrew and Leah would settle outside of Boston, with Andrew eventually becoming a tenured professor at the prestigious Oxford Institute of Technology, OXT, in Boston and a member of the prestigious Council on International Relations. Harry would eventually attend medical school and graduate summa cum laude, second in his class from the City of Saints Medical University, CSMU, in San Francisco. He would later get a master's in public health at the same university, finishing up his medical training at the CAMU James Sheep School of Medicine. After residency, and just prior to joining the CAMU faculty, Harry met his wife Marie Jo Mann, a nurse practitioner. Harry and Marie would eventually have twin identical girls and settle in the Beverlywood section of Los Angeles in a modest, but unique home from an architectural point of view. I mention this all to you because there were several peculiar things about Harry, his children, his house, and the roles of his older brother and niece. First, there was the issue of his office and its location. In fact, the first time I visited Dr. Mann's office at CAMU, I got lost. His office was on the 10th floor in the building just across from where I practiced. When I walked over and took the elevator to the 10th floor, I was expecting to see signs and at least a receptionist secretary. I found neither. I walked past each office, looking high and low, for Dr. Mann. His office was nowhere to be seen. I thought, how strange. I was just about to give up, when I walked down a long hallway, past a corner and saw what appeared to be a janitorial closet at first glance. There were no signs on the door. Absolutely no indication that it was any kind of office. The door happened to be a tad ajar, so I peeked in. There I saw Dr. Mann sitting in dimly lit room. This was the office of the Senior Vice Chancellor of Medical Services. It was tiny, more like a closet than an office, and had 0 windows. As I stood there, waiting for him to look up, I saw, like many people, he had a picture of his family on a shelf just a couple of feet from his desk. There was just one problem. Not only was Dr. Mann not in the picture, but the picture only had a young woman and a child. Not twins, just a single daughter. Again, Dr. Mann had told me on several occasions that he had twin identical daughters. Again, the same old questions kept perking up in my mind. Who is Dr. Harry Mann? Who and what did he represent? And why did it seem that he was deliberately hiding? Dr. Mann's office, the space, and its location were just the tip of the iceberg. His home took my suspicions to a whole new level. I had visited his home on a few occasions, mostly to drop something off that he had requested. As I drove up to his home at 6155 Oyster Point Boulevard in West Los Angeles, my jaw dropped. It was a home like no other. It stood out and didn't match the neighborhood nor anything else I had ever come across in my life. It was a fortress, more akin to a compound, a place where a drug cartel or mafia don would live. As I walked up to the front of his house, I could find no exterior front-facing windows, and the side windows were frosted. There were commercial-grade surveillance cameras in the front, on the roof, and all around the perimeter. The front portion of the house was reinforced with a secondary structure to provide an additional layer. As I approached what appeared to be a front door, I saw a doorbell camera and pushed it. Patiently waiting. Standing there in the front of the door, I saw what appeared to be white caulking around the front doors, as though they were not real and did not open and close. It became immediately evident to me that the whole exterior structure of the house was fake and was there for added protection and security. Sure enough, the door never opened, and after about minute Dr. Mann came from around the house. I then handed him the documents and quickly scuttled away. The funny thing is that now that I look back, I can find more and more strange things that never registered at the time but make sense now. One thing is Dr. Mann's eating and drinking habits, or I should say lack thereof. The few times that I have even seen him participate in any social gatherings, which were few and far between, he would never take a bite or a sip of anything, no matter whether it was alcohol, coffee, tea, or even water. Whenever food of any sort was being served, you would find Dr. Mann staying clear of everything. During my entire time at CAMU, I never saw him eat at the cafeteria one time. No holiday parties, nowhere have I ever seen him eat or drink. Scary, but when I put everything together now, it's as though Dr. Mann was fearful of being poisoned. Which again begs the question, who is he and who does he represent, who is he hiding from and who is he afraid of? I keep thinking, could Dr. Harry Mann be the center figure of an organized crime network, a foreign intelligence agent, a highly intelligent, mentally disturbed psychopath, or a combination. After putting this all together, I started to get a weird vibe and panicky. Feeling that there was no future at CAMU, I chose to send my husband and children back to Chicago. I was now alone and scared, living in my apartment. Night after night, I would call my husband, Mo Lee, spending hours on the phone with him discussing what I was experiencing. This would go on for months. When my family returned to Los Angeles to be with me for the holidays, Mo and I sat down together in my apartment and began to sift through everything that I had in my possession. The goal was to find possible clues to what was happening to me. We sifted through scores of emails, text messages, my contract, and even those doctor periodic productivity reports, DPPR, that were uploaded every month to the CAMU physician portal. The first clue came when Mo glanced at the DPPR files. Suddenly, the light went on and things began to click. Mo looked up my name, reviewed my productivity, and everything seemed fine with just one hitch. Under the non-fee, Suite 1880 clinic, my name was missing and nowhere to be seen. Keep in mind that at this point, I had been working in the non-fee clinic for more than a year, and for the past 9 months, I was spending more than 80% of my time in that clinic, working only half a day per week in the Vashti clinic. Quickly thumbing through the pages, Mo finally found my name, Dr. Esther Sun, but in a very strange location. Dr. Harman and CAMU had me still listed under the Vashti clinic, Suite 1313, meaning that my entire productivity was credited to the Vashti clinic rather than Suite 1880. This was the case even more than a year after I moved my main location to Suite 1880. Mo, who happens to have a financial background, then looked at me and immediately shouted out, "Sonny, this really stinks to high heaven." For Mo, this was not a mistake and a simple oversight. It was deliberate with clear implications. It tied back to the question of why Dr. Julie Pritzker was so supportive and cooperative with my move if it would hurt her clinic financially and as a result her income. The fact is that Suite 1880 is the crème de la crème of primary care clinics. It is located on the main campus, directly benefiting from the prestige of the university. It is open to both genders and has no facility fee attached, inhibiting patients, especially those with PPO insurance. As a result, patient demand for physician services was enormous, meaning there was more than enough patients per physician, unlike in the Vashti clinic, especially if you worked hard and were willing to put in a lot of time. As I indicated, I was super motivated by Dr. Harman's opportunity, and I did not want to let him down. Therefore, immediately I hit the ground running. Upon joining Suite 1880, I saw my productivity skyrocket and my income potential increase significantly. Soon enough, Suite 1880 had the 2 most productive physicians in the CAMU Health community network, which includes over 100 clinic sites. Honestly, Dr. Ronan Bryant and I were given a tremendous advantage, an on-campus clinic, open to both genders, with no facility fee. Honestly, I have asked myself this question many times. Why were Dr. Bryant and I so blessed to be placed in the very best of all clinics? After all, Ronan and I are 2 very different physicians from what you would expect of the caliber of CAMU. We were standouts. We were neither CAMU educated and trained nor graduates from the Ivy League and or another top-ranked US program, but 2 foreign medical graduates. You need to understand that foreign medical graduates, FMG, tend to fall into 2 categories. First, like myself, born in a foreign country and educated in that country. The second situation, like Dr. Bryant, was an American who for some reason did not attend a US medical school, and thus attended a program out of the country, like the South Sea Islands or Central America. In either case, traditionally most of the top-ranked university health centers consider only US-educated physicians, and then only those from other top US programs. The question begs to be asked. Why were Dr. Bryant and me not only privileged to work at CAMU, but also at the very best clinic? What was behind Dr. Mann's decision? Do you think Dr. Harman is just a very warm, open, and altruistic person? Or do our backgrounds just simply fit better with his personal plans? Which brings me back to Mo's findings. Why was my entire productivity in Suite 1880 being credited to Suite 1313 of the Vashti Clinic? Mo raised his voice, excited, and yelled out, "It is freaking obvious, Sonny. Dr. Mann and Dr. Pritzker are in cahoots." For Mo, it was clear as a bell. Dr. Mann and Dr. Pritzker had struck an agreement. After all, it was obvious that even if I had stayed at Vashti, my productivity alone could not save the clinic indefinitely. In short time, the only option to keep the two clinics afloat would be a massive cash infusion from the Irene Vashti Foundation. So why not go back to Mama, so to speak, for help? After all, Irene Vashti wouldn't give up on a clinic which bears her name. Her ego would never let it fail. True, Irene Vashti, through her foundation, had already committed $25 million going back more than a dozen years. She wouldn't give up on it now. Definitely not. Both Dr. Mann and Dr. Pritzker knew any additional funds would probably come fairly easy. The real question would be at what cost. Julie Pritzker, who led the Vashti Clinic since its inception, must have realized that her endowed position could be at risk. What if the foundation determined that the clinic's financial struggles were due to her own mismanagement? On the surface, that would be a fair question, and that is exactly what Dr. Harman wanted people to think, and it was part of his game. You must understand that Dr. Mann, being highly intelligent, knows how to master the art of perception. Any trouble the Vashti Clinic faced would appear on the surface to fall at the feet of Julie Pritzker. Dr. Harman, being the quiet, demure puppeteer behind the scenes, would be free and clear, working his magic. The reality was that over time Dr. Harman had used the Vashti Clinic and Julie Pritzker's own endowed position as leverage against her, and literally put a knife to her throat to extract things from her. The fact that Dr. Pritzker's husband also works at CAMU only increased that leverage and the sharpness of the blade that was pressed against their necks. For Dr. Mann, everything comes at a cost. If Dr. Pritzker needed something, it soon became a matter of whether she was willing to pay the price. The reality was that Dr. Pritzker knew exactly what was needed for the Vashti Clinic to thrive. After all, the whole idea of the Vashti Clinic was to be a place where women could feel safe. She knew very well what other specialized women's clinics were doing in comparison to how little was done at Vashti. In fact, unlike at CAMU's sister school, the City of Saints Medical University, CSMU, in San Francisco, Vashti offered no specialized medical service geared toward women, such as OB/GYN, fertility, and care related to high-risk pregnancies. Sadly, the only female part of the Vashti Clinic was the name and the fact that it only employs female physicians that actually receive no special training related to women. In truth, there was no value added to the Vashti Clinic, even after more than a decade under Dr. Pritzker. Dr. Harman knew on the surface that the perception would be that the buck stopped with her. The fact that Julie resisted paying his price was not really her fault. At some point, the personal cost became too great to bear. Nobody in Julie's position could pay his price and remain well, financially and psychologically. Therefore, without any real investment in Vashti, there was no reason why a woman should go there for services, unless you like to pay for parking and potentially pay hundreds of dollars in facility fees per visit. As a result, it is no wonder why the two clinics struggled financially, and why, if you worked there full-time, especially in the fee-based suite, why a physician would be under great financial strain. A new physician, especially young with medical school debt, or one like myself, the breadwinner of a family, would soon find themselves in a very desperate situation and looking to get out at all costs. Now that you know the backdrop, you can better understand my role and why Dr. Pritzker was so eager to have me transferred out. Couple the transfer with the fact that I was an experienced physician and would be working in the creme de la creme of clinics, it was clear to Dr. Mann and Dr. Pritzker what that meant. My productivity would soar. With a wink and nod, a side agreement was made between Dr. Mann and Dr. Pritzker. The revenue that I would generate in Suite 1880 would be credited to her and the Vashti Clinic. That revenue would easily eclipse what I had earned when I was nearly full-time at her clinic. It solved everything and more. It would shore up her financial position, both as far as the clinics, as well as feed her own bottom line as a medical director, whose income is based on the performance of the clinics she manages. Mo was confident that he discovered gold. He laughed at their audacity and thumped his chest about what he found. But there were still two unanswered questions. What about the medical director who manages Suite 1880? Why would he or she agree? Why would Dr. Harman agree to such a deal? How could he benefit from it? The answer to the first question is straightforward. There is no medical director overseeing Suite 1880. It is managed by a physician lead, whose pay is for the most part determined by his own personal productivity. Suite 1880, having no medical director, is one of many clinics that fall under Dr. Harman. Whether the revenue comes from the Vashti Clinic or Suite 1880 makes no difference to his bottom line. The answer to the second question is huge and has widespread consequences that dovetails to a larger organized crime scheme at CAMU Health. A scheme that affects perhaps dozens, if not hundreds of individuals, including fellow physicians, local and state politicians, CAMU's very own president, school chancellor, and dean, and even Hollywood celebrities. On the surface, Dr. Harman plays the part of an old, genteel senior vice-chancellor of medical services. With his salt and pepper hair, greyish mustache, Dr. Mann comes across as grandfatherly, unassuming, and readying for retirement. Don't be fooled. That is just his cover. Dr. Mann is a predator, quietly stalking his prey behind the scenes, because up until now he had a secret weapon, Project Unicorn. True, you now know the source of his power, but that does not make him any less dangerous or formidable. Unicorn still makes him nearly unstoppable. Think I am exaggerating? Think about what him having access to your smartphone will do to your personal life. Besides the fact that you carry your phone with you everywhere you go, bedroom, bathroom, and on the table in front of you during your most intimate conversations, there is the camera, dual-sided now, the MIC, and all those apps and the data they house. When Dr. Mann hacks your phone, your life is in his hands. He knows when you are home and when you are not, where you go, where you shop, what you buy, and is there right alongside you and your partner during your most intimate moments. He is busy collecting all the data to be later used to get you to do things against your will. Better said, he is gathering leverage to be used to put a knife to your throat to extort you. As one independent lab recently wrote, Unicorn was designed to do two things: completely take over all aspects of the U-phone and operate like a ghost that a user would never be able to see. What it does do is gather an incredible amount of data on an affected victim. Every single text message, calendar entry, email sent through Umail, or our message is vacuumed up and sent back to whoever is behind the spying. It constantly updates and sends the user's location from the phone's GPS. And it even fully downloads the user's various passwords and steals the stored list of Wi-Fi networks and passwords the phone connects to. By harnessing the power of Project Unicorn, Dr. Harman has two jobs, one working as an intelligent agent for the Central Asian Republic, extracting information on sensitive research at CAMU and potentially via his older brother and niece's positions at OXD and the Department of State, the other enriching himself financially and forcibly engaging others into certain unspeakable acts. Stay tuned. You don't want to miss this next part since it might be near and dear to you. Especially if you use a U-phone, see patients, rely on the accuracy of health records or like everybody, a possible future patient.